Good morning. Steve Stites, Chief Medical Officer, University of Kansas Health System, back with you this morning. I'm here lonely in my studio. That has now become my studio when Hawkeye is not here and we don't have one of our guests. We're broadcasting live from the Dolph Simons Family Studio. We welcome you back to our program this morning. We have a special guest, Lee Norman, who I'll turn to in just a moment, as well as Chelsea, who's back with us from the Community Blood Bank to talk more about our issues around the blood supply. And I know that still remains a critical issue. Chelsea, we'll hear from you in just a minute. But first, Hawkeye, I know you're out there in Colorado. Nice view, by the way. I hope to be out there soon myself. But tell me what's going on. What are the numbers like today? How are things?
Hi. Well, I don't think we should be too happy or excited about this. We talked about 2 weeks ago or so, our numbers were 9 or 10 total in the hospital. We've kind of crept up now. We have 24 patients in the hospital with COVID-19. 7 of those are critically ill, with 6 of those patients needing ventilators. So we are starting to see the numbers creep up a little bit. Unfortunately, we don't want that, but kind of that's how it has been going this last 7 to 10 days for sure.
You know, it's clear that there is a wave here and we'll turn to Dr. Norman about that in just a moment, but it's very clear there's a wave here for us here at the hospital. It's interesting. Some of the demographics, it's changing, right? I mean, before we had an older population. Now we have a younger population that's here. We have a lot of people under the age of 60 who are hospitalized, and so it's definitely changing. And what we're seeing more and more of our positive tests are on young people in that 20 to 29-year-old age group. And they tend to be folks who have been out together, or they've been in a bar, or they've been partying, and perhaps not doing the things we preach every single day. And now some of their friends are ending up here in the hospital. It's very, very real. And if anybody doesn't think it is, please help educate them, because COVID-19 is not a hoax. Mask wearing is not a political crime. And taking good care of your family and friends is simply the right thing to do. Dana, any thoughts about that?
Yeah, no, exactly. We have seen that as the restrictions have lessened, people have been out more and more. We have continued to encourage, if you have to get together, please do it outside. Please maintain your social distance. Try to avoid the confined spaces. Do the important things like mask wearing. Masks can protect you a little bit. We don't really consider it as protection for you, but it can help prevent you from getting the disease, but mostly it's to help you from spreading it to other people, especially your loved ones and your friends.
Yeah, it is really important. Chelsea, how are things at the Community Blood Bank this morning?
They're okay. It's about the same as it was last week, but we did actually see a little bit of a spike in donations over the weekend after our Friday broadcast with you guys. So thank you for that. Or was that Thursday? I can't remember. Thank you for that. We do appreciate that. We're sitting still under a 3-day supply, though. So if you remember correctly, we like to have a 7-day supply on the shelf at all times. Right now, we're about 3 days. So we are creeping up. That's the good news. But unfortunately, by hearing that there is a spike in cases locally, that is going to affect us, as we saw back in March, April, and May. So not excited to hear that. Really hope that if you're healthy and you're well, that you'll come in and donate.
Absolutely. That is critically important. And it's really important that we do that at this time when we are still relatively healthy here and before another really significant wave might hit. So this is a really important time for people to get out and give that blood. Blood is the gift of life. And for all of our patients who need surgery and those who come critically ill or involved in a trauma or anything else, blood is so darn important. If we don't have blood, we can't do surgeries. We can't save lives. It's very simple. So we really need you to help us. Lee Norman, what is going on in Kansas? What's going on out there? Because we know that cases are rising. I've left Lee Norman speechless. I want to tell you that's the first time I've been able to ever succeed at doing that. And I'm going to bet that, let's try that again. Lee Norman, are you out there? All right, technical things. We're going to keep working on that. So, Chelsea, I'm back at you. So how many people need to donate blood a day normally to keep this at a good level set?
So every day, including weekends, we need to collect at least 600 blood products in order to adequately supply the Kansas City area, the St. Joseph area, and the Topeka area. So it's a heavy burden on our shoulders, but it's something that we've been able to do pre-COVID. So we're hoping that we can get back to that in the middle of this pandemic as well.
Well, and I would think in early March, when people were maybe not donating as much, it didn't affect us quite as much because there weren't as many surgeries. People weren't driving, so there weren't as many traumas. I'm going to bet the blood usage dropped off. But now as health systems have ramped back up across our region, all of a sudden the blood products are going up and people are driving, there are more wrecks again.
Yeah. When March came, we were still hosting blood drives out in the community. We were still collecting a pretty decent amount of blood. April came and we had to cancel everything. Only our donor centers were operating. And I said before, we actually normally collect 70% of our blood supply on blood drives out in our community. And that's just not the case anymore. We're probably not going to be able to get back to that 70% on blood drives versus 30% in donor centers model for the rest of the year. Most of our blood drive locations are either too small for us to maintain social distancing or they're closed. So right now, we're just focusing on sort of changing donor behavior, getting people to come into a donor center rather than waiting for us to come to them, which depending on where you're at, especially if it's a rural place, we might not be able to come to you for a while. So don't wait. If you're out there waiting for us to come to you, please come find us. We have 7 donor centers. We've got a bunch of community drives that we are able to host, large venue drives as well. But our donor centers are there 7 days a week. So
yeah, we need you, and trust me, Kansas City, we need the community blood bank, and it's just our community blood center. It's just so darn important. So we've said before, BKC, we bent the curve. Now we got to bend the curve of blood donation up. So please help us and help you take care of others, and just know that this is really a critical time around that. Dana, you still seeing a lot of good mask wearing out in Colorado?
Yeah, it's good. Like I said, the culture is just a little bit different here. Lots of mask wearing, lots of available hand sanitizer to the general public, going into restaurants, going into stores, lots of outdoor seating. So, they have really embraced this culture of trying to protect other people and themselves. And I think that's something that we all need to do around the nation, especially in Kansas City.
So are most stores and most places open in Colorado? Can you go in and shop?
Yeah, where I have been, some of them don't really have restrictions. I actually had to wait in line yesterday to go into a sporting goods store because there was 2 other people in the store. So some stores are doing that. I think some of these things are out of an overabundance of caution, but I think it's good, and I think it's a good culture change, and they are really trying to protect everybody in the community.
Oh, that's really important. All right, well, we still don't have Lee Norman back yet, so let's see if we have questions. And if Lee joins, we're going to get right to some of his things. I got questions for Lee. I wanted to ask him. I want to know what states are going to come up next and go on our travel restriction list. We're a little nervous about people wanting to travel to Florida and Texas right now just because watching the numbers rise there gives you the willies. And, of course, those are 2 big vacation states. So we'll get Lee back. If not today, we'll be sure he's here this week. But we'll keep trying today. Jill, what kind of questions are we seeing so far?
Well, we do have questions for Dr. Norman, but we also have questions for you doctors. Elena wants to know, there was an article about how the MMR vaccine could be beneficial. Are there any studies on this in the U.S.?
Dana, the MMR vaccine. I'm not sure. I'm not sure I quite get the connection, but you're probably smarter than I am here.
I'm definitely not smarter in really any aspect. However, there has been talk even about the polio vaccine and, giving it again. It's more, I think, of a total activation of your immune system. So getting your B cells activated, not necessarily for specific immunity against coronavirus, just an overall immune mechanism or an immune system activation. So it's, again, I haven't seen the measles, the MMR vaccine, but I've certainly seen some discussion or reports on maybe the polio vaccine. Again, it's not going to be like a specific vaccine for coronavirus itself, but it could help to activate the immune system. But there's really no good data or studies to support that.
They can do. But you should still go get your MMR. That's a different statement because you want to protect yourself. You sure don't want to get two diseases at once. I believe we have Lee Norman back on the line. I'm not sure what he was doing out there. Maybe he had a little tiddlywinks he was doing. But
you guys muted me.
Dude, what's going on in Kansas? It looks like the numbers keep going up. Talk to us a little bit about what you're seeing throughout the state.
Yeah, the state is going up. Actually in a more accelerated rate of new cases. We're over 12,000 cases in the state now, 12,059, which is an increase from 378 cases from Friday, 7 more deaths since Friday for a total of 254. It's still the same patterns that we've been seeing in congregate living arrangements like in nursing homes and prisons and then in close proximity, we had in work settings, meat packing and food preparation and the like. So it's just really more of same. I do think that we've had a few cases trickle out of, gatherings like protests and, party cove gatherings and those things. I think it's a real profound reminder, and especially with 2 of the 12 worst states in terms of their rate of new cases being Missouri and Oklahoma. The border doesn't stop viruses from entering. So I think we're on a bit of a banana peel in terms of people feeling more relaxed, being out more, and then having a bunch of states with increased number of cases, and they're very close by to us.
Yeah, I think that's right. I keep seeing the behavior, walking down the street at bars and restaurants, and not seeing a lot of social distancing, not seeing mask wearing. What drives me crazy is when the people inside the restaurant who work there and are delivering the food aren't wearing the masks. Talk to us a little bit about that, and why has mask wearing become so darn political?
Well, it just doesn't make sense that it's politicized because masks work. This is not a new discovery. We've known this for a very long time. And I think people just don't like them. And somehow, and I think it comes from the top of our United States government, there's been a discounting of the validity that masks work, when in reality, I think it's being spun politically for completely different reasons. So there's nothing to defend not wearing of a mask. I do think one of the things that, as as a matter of fact, I was in front of the legislative committee all day yesterday and will be again this morning. I think also I watch them fuss with their masks, and I think that one of the things they haven't paid enough attention to is having something that's well-fitting enough that it doesn't fog their glasses and become an annoyance, because things that annoy people, especially when you couple that with the belief that things are getting better out there, then people will forego wearing of the mask. So I'm also encouraging people to figure out ways, to have metal bridges of the nose, to use paper tape to fix it to their cheekbones, so that it doesn't fog their glasses up. I mean, to work at it and not just to slap something on that doesn't fit and probably isn't effective anyway, or as effective anyway.
So, Lee, what's your advice for people who want to travel? Because we're seeing the quarantine from KDHE. As you know, we try to follow your recommendations pretty closely. You and I are on the phone a couple times a week, sometimes just yapping to make sure we got them right. What about other major travel states? We know you all we had Arizona, Arkansas, Maryland, and some others last week. Texas and Florida look like they're exploding. Is that coming next?
Well, the trajectory is certainly for that, Steve. And Alabama was one of the other ones that we added, the 3 A states, Alabama, Arizona, and Arkansas. Maryland was there already. And it is controversial. I will say there are some states that have given up on having any kind of travel-related recommendations for quarantine. I think it's because of a couple of reasons. One is that it's hard to anticipate. People are those that are traveling by planes buy tickets well in advance. And I grant to you that when we come up on relatively short notice and say this week these 3 states have been added and these 2 states have been dropped off, that is kind of abrupt, but those are what the data reflect. And by the way, it's not a popularity contest. This is based on per capita rate of new case growth. In the case of the 3 I mentioned, they are 3 to 5 times greater than the rate of new case development that Kansas is. And the rationale behind this is, and people don't seem to grouse about travel bans for going to other countries, And a lot of the other countries that are banned are much lower than the states that are on our travel-related recommended quarantine. So, it's kind of fuzzy logic to say when somebody's coming in from Europe, they're coming to a much less safe place by coming to the United States. If anything, they should be having these and I don't know if they do or not. They should have mandates against coming back from some of these states that are on our list.
You bet. So Hawkeye's out in Colorado, and he's supposed to be back to work sometime, I think, next week or whatever. Do I need to worry about him because he's in Colorado?
No, you always need to worry about him. Don't worry, we'll stop him at the Colorado border and keep him there. No, Colorado is not one of them on that list at this current time.
Good. Well, Lee, first of all, let me thank you for all the work you do. You and I have known each other for years. You're a good friend, and I can't tell you how much I appreciate your being out there leading the pack. I have a story to tell, though. It's not about this time. It's a good story, but it's this thing about people not wanting to wear masks and thinking it's political. And I just sit there and I think, okay, you're going to go have open heart surgery. Are you going to say to the surgeon, listen, I don't believe in masks, so don't wear a mask when my chest is wide open. You can go ahead and just breathe right into my chest. I don't think most people would do that. So why, in the age of COVID, would you allow somebody to breathe right on you when you know the coronavirus is right there? So let's try that again. Are you going to let the surgeon do open heart surgery on you without a mask? Of course, that's not a multiple choice, folks. That is not a multiple choice test. The answer to that is no. But you'll let your friend breathe right on you. I just think that's bad advice. Don't you think, Lee, that's not the right thing to do?
Yeah, well, and I think it also shows the mindset, which is I'm protecting me, but I don't care as much about you. And that's just not a healthy mindset anytime, let alone during a time of pandemic. I should care as much about you as you should care about me, and we're in this together. And
we should care
there's also
other.
There's this belief system that certain activities protect you. And I can tell you that Eastern Oregon Pentecostal church gathering with, at latest count, 256 cases. I'm sure there'll be some deaths. Here in Kansas, in one county, there was 3 rather smallish funerals that had so far between 40 and 50 cases and at least 1 death so far. So, I mean, I don't have anything against religious gatherings or funeral gatherings. I just have a problem with gatherings, because there's nobody's protected. And that's why the governor came out yesterday at her press conference recommending to stay in the 3rd phase of the opening plan, which has gatherings of 45 or less recommended. And even that's, I think, pushing it a little bit. People still need to socially distance, but there's nothing at a funeral or a religious gathering that's protecting those people. And we're seeing it from coast to coast. I think people just have to get real about it and say, I can withstand the temptation to gather in large masses.
Rule number 1, save the patient. Rule number 2, do the right thing. Not that hard. Mm-hmm. So, Lee, is there any chance that there's enough appetite in Kansas that our numbers continue to go up? We're actually going to see any form of a shutdown again? Well,
we're certainly trying hard not to. And by extrapolation to schools and K through 12, higher ed, and then certainly businesses and things. We're doing everything we can to not have that happen. And, I think we're in pretty good shape for being able to respond better. I wouldn't have said that 3 months ago, but now with our significantly increased testing, we can get to large numbers of people. We've had 2 large outbreaks, one in a county jail and the sheriff's office and all the law enforcement in the county. One was down in a plant in southeast Kansas. We were literally able to go in same day, assess the situation, gather test samples, and have the results back by the end of the next day, and then circle back 5 days later, 7 days later, repeat testing on everybody, staff and residents alike. We had the Kansas Neurologic Institute here in town in Topeka. You may have seen it. I typically don't name particularly businesses or entities by name unless it's become public information. But there's a dozen cases so far. We've tested everybody in 2 buildings, both the residents and the staff. So I think one is we have adequate testing capability and rapid enough turnaround 2, we have sufficient PPE for first-line providers in healthcare and emergency management and the like. So I think that our resiliency is much better than it was. So back to your original question, Steve, I think that we're in better stead to not have to do that. We're very much loath to close anything down if we don't have to. And, you know, we're one of the few states that actually kept so much of the businesses going that would have had profound consequences. Now, they may not have been at full production, but enough to keep food coming back out. So I think we've done pretty well, but we just can't let our guard down. I think we're still in for an 18 to 24 month slog through this. I don't think there's any magic.
It should come sooner. I'm going to go 12. I'm going to say 12, brother. We're going to say 12. Let's try that.
Okay, well, I appreciate your youthful optimism, and I'm going to stick with 18 to 24.
All right. I think we have some questions for you, Lee. Jill?
Paula wants to know if the KDHE will be giving local municipalities guidance to issue mask-wearing ordinances.
Oh, mask-wearing ordinances. Do you think that would happen locally, Lee? And can KDHE help with that?
I think it would be unlikely to be mandated by the state. The counties have the ability to do that now. I think it's a good question, not just about masks, but about how far do you go on anything that, you know, we have COVID-19 identified in 92 of the 105 counties, and all counties are not created equal. And there's some where that would be overkill and not necessary, would not be recommended, and some where I think it would be recommended. I think we need to get much more strategic about where we put mandated mask recommendations into place. The bottom line on that is I see that and this is how I even embody this personally, is if I can't control my environment, like I'm fine in my office sitting right here, there's nobody in here, I've got all the room in the world, but I step out and I get on the elevator, I put a mask on. And the reason is I don't control that elevator. I don't control the number of air exchanges. I don't care. I can't control if somebody gets on the elevator and doesn't have a mask, or if they do have a mask, or a group of people even. Elevators are evil. You can't control the environment in an elevator. So
Theirs are not as evil.
Extrapolation,
yeah.
by extrapolation, and imagine being in those 50, 60-story elevators in high-rises in Chicago and those kind of places. So look at your environment and protect yourself.
No, that's why, you know, I have stairs. I do, you know, the good news is that I'm still young enough, as you referred to my youthful energy, my friend, that I can still take the stairs, and that's helpful. But, you know, I do think that's a challenge for folks as they get older. Here at the hospital, we have that 4-person per elevator rule, and that's a stress, but the rest of us just need to be on the stairs. So that way we let the people who need to use the elevator, Jill.
Debbie wants to know if you're going to track cases in the dentist's office and orthodontics.
Yeah, but you know, that's been the highest risk profession, have been dental offices. They're back open again, Lee, but I bet you are tracking that pretty closely.
Yeah, we know where cases occur. You know, the case investigation and tracking is for the most part done in the counties, county health departments. We augment them if they've been overrun essentially because of an outbreak. But we know kind of where every case comes from, if it's tied, if it can be found. You know, the definition of a cluster is just 2 cases if they're tied to one location. And we have not seen a big uptick in that at all yet. But then again, that will be a lagging indicator by the time that cases get investigated, contact tracing done, and then by the time it gets put into our epidemiology tracking system. So yeah, we're watching all business sectors closely, again, with the idea of being helpful and providing very industry or sector specific information to push the risk down.
Yeah, it's not the dental office, it's the Jayhawk Shocker Wildcat Bar. That's the one that we have to worry about right there. It's that Jayhawk Shocker Wildcat Bar.
Yeah, I think that's right. And, you know, people, you know, especially you throw in a bunch of alcoholic beverages and then people get closer, they yell and discharge droplets of infection in the air. We do see anything that has people in close approximation drinking alcohol is where we're seeing clusters.
You know, isn't that just it right there? And that's why it's affecting so many 20 to 30-year-olds. We're seeing it here in the hospital in our test positivity rate. We're seeing a lot more 20 to 30-year-olds when we're seeing. I'm betting that's what you're seeing across the state.
Yep, and across the nation.
Another question.
Anna writes that she lost her husband to COVID.
Wow.
Now her children, it's time for sports. She skipped the first 5 baseball games. There are rules in place, but she's observing the rules aren't being followed. She wants advice. Should she let her children play sports?
You know, Dana, this is a question we encounter all the time. That's hard. First of all, heart goes out, and we're very sorry for your loss of your husband to COVID-19. And that's just got to be a nightmare now to think about. Can children go back and play sports? You want your kids to go out and do activities because they lost a father, or you lost a husband. Wow, that's a hard one. I think that, first of all, we know that kids tend to be a lot healthier with COVID-19. They tend not to be spreaders either. So that's probably important things to remember. But for you at a game, or at a practice being around other adults, it's all about, if you're going to be outside, A, that's a win. B, wear a mask. C, wash your hands. D, sit away from everybody else. If you do all those things, you could probably stay pretty safe out there, Dana. What do you think?
Yeah, absolutely. We've always talked about being outdoors, being distanced. You can do that outdoors, even if you're watching your children play sports. So that is always the hard question that we have to answer on a daily basis. But I think if we can continue to be outdoors, yes, you're going to decrease the chance of you getting it or anyone else getting it during those activities.
Yeah, it's tricky because it's everywhere, and even if you let your guard down for one second, even if you don't let your guard down, you can get it, and that's part of the challenge. Lee, what do you think about young kids in sports right now?
It's a mixed bag. I mean, they will spread it. And, we've been seeing that, not that college athletes are young kids, but around the country, there's been pretty significant transmission from primarily college-age football players that are coming back. They're not even in contact sport part of it yet, but they are in close approximation, huddles, and locker rooms and the like. Extrapolate that to children, and I think that you can do things to mitigate it by, not having them change clothes in a locker room, not having them shower afterwards. But there's no way it can be mitigated down to zero. Kids are less likely to be made quite ill by the disease, but they certainly can transmit it. So I kind of think it's important for mental health and other reasons to get back out there at it, and I encourage it. But I think that those engineering things and scheduling and just have to change it and to try to keep the risk as low as possible.
It's interesting. We had some of our Children's Mercy colleagues on about 2 weeks ago, I think, and including their head of infectious diseases and their chief medical officer. There had been some research that suggests that younger children and even young adolescents tend not to be spreaders. It's a little more like tuberculosis in that regard. It tends to be, people in their 20s or late teens, and older folks tend to be the spreaders. But for some reason, kids do something with the virus and they don't tend to spread it as much. Have you heard of that too, Lee? I know there was some evidence that had been published about that the Children's Mercy ID docs were talking about.
Yeah, that's right. And that was also studied up in Iceland. And I don't know exactly the methodology, perhaps you or Dana do, but we're able to find out that a lot of times that it was suggested that it was the kids that gave it to the adults, when in reality it was the adults that gave it to children, more likely than not, if they resided in the same household. And that was going against what we had earlier thought was the case. We have tracked a number of cases. We had just last week a 2-month-old and a 4-month-old that we know came in these respective households from the parent that was the father who was at work. And both of those two came from the same work setting. And because the mothers of these 2-month-old and 4-month-old were not infected, so it did come from the father infecting, in this case, 2 little babies. So, yeah, you're right on, Steve.
Dana, I see you shaking your head. What are your thoughts?
Yeah, we were talking about the methodology. I think those studies were based on indirect evidence, based on contacts in the household, just as Lee was talking about. There was less spread based on children having it in contact in the household. And so they deduced that it was probably children were less susceptible and less spreading, which was contrary to what we thought for the most part about a lot of different infections such as because children can pick up a lot of different infections in the daycare centers. And so, yeah, continue to that. But also remember the Chinese study that looked at people who were asymptomatic, and that cutoff was 20 or younger. So luckily, children and young people don't seem to have the proportion of severe illness that adults do. And those numbers of people, patients, tend to be, if you're 20 or younger, you tend to be asymptomatic, but you can still spread it.
Yep.
Debbie wants to know if we have enough contact tracers in Kansas, and if someone wants to volunteer, where do they go to help?
Oh boy, Lee, I know you've got the Army of 400. I'm going to call that Norman's Army.
Yeah, we do have enough now. Matter of fact, we have trained, I think, right at 400, and between our internal staff who get called into action, of course, for contact tracing, and then the additional of about 125 that are still stood up at this moment in time. We've got another almost a couple hundred that have been trained, but have essentially been put on pause. We just haven't needed them yet. So I think we're in pretty good shape. I mentioned earlier about resilience in the system as we open up more with schools and whatnot, having enough testing. Contact tracing is another one of those that is one of the essential elements, and we're in pretty good shape. We do have the ability for people to sign up, but we're not doing any tracing now. So I think we should just probably put that on pause for now. It doesn't make sense to train people now when we've got enough for the future. And we think we have enough if there's an increase by 2 to 4 times the number of cases that we have seen statewide. But we might turn that light switch back on again.
Good deal. Well, it's great to know we have those tracers out there, because I know that was a real challenge at first.
Allison writes,
Yeah, it was.
Allison writes she saw in the news that COVID has a new strain and it's more infectious. Is that true?
Dana, boy, there's always this talk about strain this and strain that. Sometimes it strains your mind trying to keep up with the strains.
Yeah. Right.
That was good, right? Not bad for an old man. Go ahead.
That was a good tongue twister. Yeah, so we have talked about this before. They've identified different strains based on the genetics. We don't want to call them new strains. There's no really biologically different or clinically significant virus out there. One of the things that she's probably talking about is this D to G change, which is an amino acid, which is actually an alteration, not really a mutation. Mutations tend to happen at the genetic level, at the base pair in the genome. It is a small subpopulation. It's an interesting find. As we move forward, we can continue to look. That experiment also looked at, that was in lab conditions and done under different real specific conditions. There may be some increased infectivity. It's really hard to say. We don't know if it's more pathogenic, however. So maybe it's more infectious, but maybe we don't know about the pathogenesis and the pathogenicity of it. It's somewhat complicated, not to get into the weeds too much, but still, there really isn't a specific biologically, clinically different strain that is out there, even though they have found these other things. And as time goes on, we'll continue to watch it. It's certainly interesting, but that's the bottom line.
Yeah, that's what we're thinking. And even that D to G change doesn't really change the behavior of the virus. There's been some talk in Europe a bit that it's becoming a little more mild. Not sure if that's the case, or maybe people are just doing a better job following the basic constructs, because it's interesting, in several countries in Europe where society has been reopened, they're not seeing another rise. Lee, as I look at that data, it looks to me like folks are sitting outside wearing masks.
In Europe, you're talking about, Steve?
Yes, sir. I think in Italy they aren't seeing the rise in northern Italy that they had anticipated. France, Germany, sort of the same. Germany went up a little bit, but I know in Italy at least there was an article over the weekend where they were talking about how that had not seen the rise in Italy that they had seen, that they expected once they started reopening society. They're a few weeks ahead of us, but it looked like the key was outside, mask wearing, social distancing, hand washing.
Yep, that's the age-old secret sauce that you just described. I think that is the difference, Steve. I don't think it's any inherent difference in the infectivity or severity of the virus itself. I think it's human conduct.
Janessa writes that it's school registration time. Her school has 2,100 students, 200 teachers. She wants to know what Dr. Norman thinks about going back to school.
All right, let's talk about going back to school. We'll talk about also opening up universities. Lee, school.
Okay. We're working closely with the Kansas Board of Education, or Department of Education, excuse me, and the Department of Education will roll out recommendations after meeting with the Association of School Superintendents. Recall that it is the local school board that determines the answer to the question. We work with education. We provide public health guidance. They will recommend certain engineering and other kinds of guidance, scheduling and the like. And superintendents will line up with them and with some agreement, hopefully, and provide it to the school boards as kind of the best thinking on this topic. But it's the local school boards who will ultimately make that decision.
Yeah, no, we've been working hard, Dana, with the University of Kansas and Lawrence, trying to think about how do you reopen an entire college campus.
Yeah, absolutely. We have worked with the athletics, the general students. It's a very daunting task when you have, 20 to 25,000 people or more coming back to this area where there is dorm living and fraternity or sorority living. It's very daunting. We have worked with the executives there. We've worked with the local health clinic. There's a lot of aspects to that. We certainly want to try and mitigate the risk as much as possible, be able to identify cases and contacts. There's a lot to go into it. We're talking about, how are kids going to go back to school? Are they going to be wearing a mask during classes? Again, we talked about the younger population. They should be fairly healthy for the most part. But what about the teachers and other support staff doing that as well? So we want to try to protect everybody.
Yeah, it is a big task, and trying to keep all the kids as safe as possible. How do you do that? And we're in hope that have salival testing. We thought that was going to be here pretty shortly, but if that's delayed at all, then we're still doing nasal swabs, and man, that's a lot of brain biopsies to be doing.
Joyce wants to know, she saw a report on the news with a doctor who was interviewed that said the younger people might not be getting off as easy as they think. He pointed to CAT scans that show they may have chronic lung disease that they will deal with for the rest of their life.
Yeah.
Thoughts?
Yeah, here's the deal. We do know that at every age group you can die, right? It's just the risk of death begins to go down pretty significantly once you get below 50, and certainly once you get below 30 and in the 20, and then you get below 20, it just continues to go down. So the risk of death and the risk of long-term complication goes down. That's not to say you can't have them, because of course you can. And that's why we say to people in that 20-year-old age range, of the folks who are not wearing masks but are becoming the spreaders, you got to take care of each other, and you got to take care of your family and your friends, and you don't take care of each other when you're in close distancing. It's hard, right? It's really hard, because it's been a long time, but it's not there yet. And the behavior that we see of people going back to bars and restaurants and doing things, especially outside or inside, and especially without masks on, that's just an invitation for disease. That's an open invite for COVID to join your home. If that's what you want to do, okay, but Godspeed, and be aware that we say that young people tend not to get affected by it, and that's true. But the operative word is tend. It is not a guarantee. It is just a shifting of risk. So how much risk do you want to have while trying to live the rest of your life? So Lee, let's have any final thoughts from you today before we sign off?
Yeah, before I sign off, as I'm sitting here, I got a text from somebody that asked me a question, if I may read it and answer it. And we kind of touched on it earlier, but I think it bears repeating. Why are there still travel restrictions to other states when Kansas is ramping up in cases by the day? ? And the answer again is that the per capita new case rate development in the states that are on our list are 3 to 5 times greater than that same rate in Kansas. So more disease activity there, less here. And 3 to 5 is kind of our threshold for even adding them onto the list at all. Anything below that, we'll say, we'll watch it. But keep in mind that we were at one point in time with New York, for example, they were 12 times the rate of new case development as Kansas, and New Jersey was the same way, which is, of course, why they were added onto that list. And when they get below, at or below where we are, then obviously we take them off the list. And we look at them in two-week increments. That's my final thought, Steve.
Thank you again for all the work you do, man. I can't tell you how much appreciate your leadership and your hard work around this. Chelsea, we know you're trying to keep the blood bank safe. Talk to us again. Let's reinforce the message. A, we need blood, and B, blood banks are a safe place to go and give blood.
Yes, yeah, we definitely need blood. If we're going to keep spiking our COVID cases like this throughout our communities, it's going to impact our blood supply. That's what we saw in March, April, and May, and that's what we're going to continue to see if cases rise. So definitely encourage you to come in now. Don't wait. If you are healthy, please come in and make a blood donation. Blood isn't used to treat COVID patients, but it is used to treat a host of other patients that need blood every single day. So please don't let that fall by the wayside. If you're eligible to donate blood, make an appointment now at savelifenow.org. If you're concerned about safety protocols that we're taking, we have all of those listed online at savelifenow.org/coronavirus. But in short, we're wearing masks. Donors and staff are required to wear masks inside our buildings at all times. We're temperature checking at the door, constant disinfecting. We're maintaining social distancing, and we're encouraging those appointments so that we can make sure we're prepared for the crowds that we're going to see. We do have a host of upcoming blood drives at some large venue locations that are safe. We're able to practice social distancing there. So we use all the safety protocols that we use in a donor center out at our blood drives. We'll be, as you can see, at KU Medical Center Wednesday through Friday of this week. We'll also be at Hy-Vee Arena on Wednesday, the Stony Creek Hotel in Independence, and the Sports Pavilion in Lawrence. So definitely make appointments for those drives if you're in that area. And if you're not in that area, in those areas, please find a donor center. We've got 7 of them, and we want to make it as convenient as possible for you to donate. So come on in.
And we need you, KC. We need you. You lined up for the Hyatt. You lined up for 9/11. You lined up for Hurricane Katrina. Let's line up. Let's be KC. We need that help because people are still sick, unfortunately, and they're not always sick with COVID. Doc Hawk, final thoughts out there.
Yeah, I'm heading back east. I'll be heeding my own advice when driving, practicing mask wearing when I'm entering a building or a place, doing hand hygiene. Right now, I'm in the back range of the Rocky Mountains in an area known as the amphitheater. Steve, I think you would like it. There's a lot of streams out here you can throw a line in, a lot of trout. So we're going to try and be safe on our way back and do all those things and get back to Kansas City in a couple days.
Well, stay safe, enjoy the trip, and to all of our folks out there, remember that those infectious disease pillars make all the difference. Hey, a couple of things about tomorrow. First of all, we're going to be talking about navigating healthcare costs that are related to COVID-19. That has been a question we've had a lot of. We have a couple of great experts who are going to be here to help us with that conversation. So be ready with those questions because those are really important to us. Also remember, and we know we don't get to every question. We're trying to work harder and harder to make sure we do. Fridays is going to be a Q&A session almost entirely. There will be some occasional guests. Senator Moran sometimes comes on and joins us, and that's always incredibly helpful. But really, we're going to try and focus a lot of questions on those days. And then today, we want to see some photos of how people are staying safe. Special thanks to Kathy Bond and her family. We love the mask on that little person there. Kendall, his wife, and grandson have been faithfully socially distancing. This is a picture from the zoo that's taken earlier during COVID-19. Amy's best friend is out there who she likes to socially distance with. And thanks to Jamie and her daughter, who also wanted to share their 4-leaf clover with us for good luck. Remember to send us your photos about staying safe. Show us your photos about wearing masks, socially distancing. You can send those to medicalnewsnetwork@kumc.edu. COVID, let's just say, COVID stinks. What a pain, right? COVID is really, really, really hard. What's harder is being sick with COVID. Stay safe out there, and remember, there's still no place like home.